Dear colleagues, we're taking the next step now in the respiratory system. I'm on page 816 of my book, and looking here at the mechanics of breathing, and we're going to consider a 1, 2, 3 in this section. There's 3 ways of increasing the amount of air in the lungs. We have to change the volume. So we're dealing with atmospheric pressure, and so that means that we have to create a partial vacuum by changing the volume. You increase the volume, you reduce the pressure inside the lungs, and air comes in spontaneously. And we're considering that atmospheric pressure at sea level 760 millimeters of mercury, or 760 torr it's sometimes called. Okay, so as we take a look here at this next figure, what we have is the pleural cavity depicted here in this reddish brown color, and so the inner layer there, I'm sorry, that's the wall, and we have, this is the interpleural space, and its pressure -4 millimeters of mercury. That holds open the lungs. So right here we have the visceral pleura, and then on this side we have the parietal pleura. Here we have the space, which is a potential space, and basically these layers are held together by hydrogen bonding, weak forces, and so the lungs will remain inflated. And the idea here is that we can use the diaphragm. 3, 4, C3, 4, and 5 from the phrenic nerve operates the diaphragm. We increase the volume, the vertical volume here, by contracting this musculature. It becomes shorter, the diaphragm moves down, and we've created a greater volume, a vertical volume in this case. So that's number 1. Another thing that we can do to increase volume is we can use the external intercostal muscles. By using the external intercostals, we're lifting one rib above is going to lift the rib below, right? And so it's sort of a bucket handle. Here's the hinge right here on the sternum, and we're going to lift up, and we're going to increase the lateral dimensions here. Notice that here we have the expiration, and there's less air in the lungs, and there's less volume left to right, lateral left to lateral right. And here we've increased the volume. Okay, and you have to think of the ribs as kind of like little bucket handles that are being lifted up and to the side. So you have that sensibility. And then what muscle is doing the inspiration here? It's the external intercostal. What's the expiration? It's the internal intercostal expiration. Okay? Then over here, we're going to consider the idea of forced inspiration. A forced inspiration occurs when you've been, for instance, swimming, and you were underwater, and you broke the surface. You need to take a breath, and so you throw your head back. There's a reflexive kind of thing that happens where you throw your head back, and you're going to breathe both through your nose and your mouth, and you're going to gulp air, as it were, have a forced inspiration. This is going to be, by throwing the head back, you open up the airway, of course, at the neck. And we're going to be using these muscles to lift the chest. So we're going to be using the scalenes, the sternocleidomastoid, and the pectoralis minor muscles. And we're literally going to lift the front of the chest up. So we're creating more space anterior to posterior. So let's review that. We have increased the vertical volume by contracting the diaphragm and creating more vertical space. Then we've used the bucket handle method to open the lateral aspect and improve that dimension, the lateral dimension of the volume. And here we're lifting up the front of the chest to increase the anterior-posterior dimension inside the thoracic cavity. So I need you to know these muscles. Okay, then we're going to come over here and we're going to notice this little diagram here that's describing the breathing pattern. So we see little sine waves here. You're breathing in, breathing out, and when we're at rest, the breathing has a small volume. We call that the tidal volume, maybe 500 milliliters. Okay, so about that much. A small bottle of water would be that much. So we're not using very much of the lung capacities. Okay, then notice if we take a maximum inhalation and a maximum exhalation, we still have this reserve or residual volume at the bottom here. We don't actually use, we don't have access to every single portion of our lungs. So there's always going to be a slightly unused portion. Okay, so we sort of measure these things. We can use what's called a spirometer, and by breathing into the tube up and down, it's measuring our tidal volume, and then we take the maximum inhalation using the spirometer, and then we breathe into it and we push the air all the way through this way. So we release the air that we've breathed in, plus we go as far beyond that as possible, might even bend over and pull our belly in to get the last little bit of air out. Okay, and so we measure this capacity through here. And what is that capacity? That's this one here that's called the vital capacity. Don't confuse that with what's called the total lung capacity. No one uses total lung capacity because there is this residual aspect down here that we can't quite get to. Okay? So please know these items right here. Know what is a total lung capacity, know what is a vital capacity, and know what is a tidal volume. Okay, that's all to do with the mechanics of breathing.